Well, so of course, we've gotten a lot of questions from all of you at home. So we decided to bring in our team of experts to break things down for us. We've got NBC News medical contributors, Dr. Kavita Patel and Dr. Natalie Azar joining us now. Doctors, good morning. Thanks so much for joining us.
You bet.
Well, Dr. Patel, let's start with you. Johnson & Johnson releasing a statement last night saying safety is their #1 priority, but there are still concerns from folks who've already received the vaccine. Now, we've got a question from a viewer, from Paul in San Francisco.
I've heard about potential blood clotting in women, but what about men? Should we also be concerned?
Dr. Patel?
Yeah, Al, great question. And what we have are the 6 cases. They were all in women. I can say this, though. The reason the FDA put the pause is exactly for this reason, to have all of us who are administering vaccines to be on high alert. So even if you are a male, but you are experiencing symptoms like shortness of breath, severe headaches, something that is out of kind of the norm for your health conditions, it is a good reason to check it out. Right now, what we know so far in the United States is it's been women associated potentially with the Johnson & Johnson vaccine. Similar technology has been used by the AstraZeneca vaccine in other parts of the world, and they have seen different types of clots in men. So this is one of those situations, Al, when in doubt, check it out. And certainly, again, underscoring what Tom said, incredibly rare for almost 100% of the people. There should be nothing other than some side effects at the time of administration. But rest assured that this is safety and progress in keeping our American public safe with the current vaccine.
All right. Dr. Azar, during the White House press briefing yesterday, Dr. Fauci mentioned that the typical medication used for blood clots is the blood thinner heparin. That could actually be dangerous for patients who are experiencing this rare condition, if you will, and make the situation worse. Obviously, a lot of people are on those blood thinners. Can you explain why that is?
Absolutely, Chanel. So I know it sounds very discordant that you wouldn't want to give a blood thinner to someone who has a blood clot. The nuance here is that this condition is actually called thrombotic thrombocytopenia, which means blood clots in association with a low platelet count. So that in and of itself puts somebody at a greater risk for having a bleeding complication if you give a blood thinner. But the second is a little bit more subtle, and that has to do with the biology of the clotting altogether. Why is this even happening? And here we're getting some clues from the AstraZeneca experience in the UK and in the EU, where they have found that individuals who received this vaccine, or the AstraZeneca vaccine, in certain individuals, there was a protein on the platelet that triggered an immune response that actually caused platelets to clot. And these clots are very, very similar to the clots seen in another condition that can be associated with heparin. So for all of those reasons, and another reason that the pause was implemented is so that clinicians like myself are aware of this, and so that perhaps instead of giving heparin, maybe a non-heparin anticoagulant would be indicated in addition to various other treatments. So really, really kind of a big messaging out there for all healthcare providers on this.
Dr. Patel, you know, all 50 states now, along with D.C. and Puerto Rico, they've paused the Johnson & Johnson vaccination. But what happens for all those people who already booked appointments? I mean, how big of an impact could this have on folks living in rural parts of the country who are relying on that one-dose shot?
Yeah, Dylan, this is something that we're hoping can be dealt with quickly in a safe manner, but I do think this pause is only going to be several days. Just so you know, we had appointments yesterday, converted those appointments into shots, but using Moderna or Pfizer, which of course means that you do have to come back for a second shot. So I would say the good news is that we're still getting shots out that are preventing death, preventing hospitalization. That's the good news. I do hope we will still have this option. It's been incredibly useful, not just in rural settings, but we've been using it in mobile clinics, in urban settings, on hard-to-reach populations, even inside of our cities, where we know working moms and dads and people just can't get to vaccine appointments easily. So I do hope and have confidence that this will be another option. Good news, people's appointments are getting shifted, and we're not canceling appointments, just rescheduling things to make sure people can get the safe vaccines as quickly as possible.
That's great.
That is good, yeah.
All right, Dr. Patel, Dr. Azar, thanks so much for joining us. We appreciate it.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.